It is best to refer cardiac cases to a board-certified cardiologist. A cardiologist is better qualified to diagnose and treat these cases. But we all know there are clients who choose not to go to a cardiologist due to cost or travel time or some other reason. In such cases, you should record the owner's choice in the patient record, and then, as always, you do the best you can for your patient. Hello, I'm Dr. Craig McInnes, and I will guide you through this training. At the time this DVD was produced, most people who learned ultrasound like I did have had minimal instruction and had to figure most of it out for themselves over time, hence the long learning curve. My goal is to help you become better than I am and to learn faster than I did. The purpose of this DVD is to help you develop the skills needed for cardiac ultrasound to assist you in diagnosis and treatment of your cardiac patients. You can do this. Should you need to consult with a cardiologist, this DVD will also help you develop ultrasound skills to acquire accurate measurements, images, and video to submit to a cardiologist. If you are like me, you will need to watch this DVD several times to understand and develop the basic skills. Then, over the next few weeks or months, you will review parts of the DVD again and again to understand and develop the more complicated skills. Goals of a cardiac study. A. Assess severity of disease. B. Monitor progress of disease. C. Determine and evaluate treatments. Objectives of this training. The student will be able to demonstrate the following. A. How to hold the transducer. B. How to use the transducer to move the ultrasound beam. C. How to optimize the ultrasound image. D. Measurement of cardiac wall and chamber dimensions. E. Use of color flow Doppler. F. Use of spectral Doppler. G. Interpretation of cardiac measurements. Entering patient information in your ultrasound machine will establish a patient record before the exam. This will allow you to store images and record measurements for that patient. Many ultrasound machines will eliminate any current calculations when you change to a new patient, so you should save an image of any calculations you will need to review in the future before you establish a new patient record. Choosing the cardiac exam option will optimize the machine's presets for a cardiac examination and reverse the index indicator on the ultrasound screen. Unlike abdominal ultrasound, it is desirable for the patient to have food and water up to the time of the cardiac ultrasound. You do not want the patient to be dehydrated for the study. You may want your receptionist and technicians to stress this with pet owners. The patient can also have a walk to urinate and defecate just before the ultrasound, so they are empty and comfortable. Do not withhold medications on the day of the ultrasound. It is usually best to shave hair from the area where the ultrasound transducer will be in contact with the patient's body. This is the lower third or half of the thorax, just caudal to the elbow on the right and left side of the thorax. You may want to place your hand over both sides of the chest to locate the pulsation of the heart. I also shave the patient's foot or tail for a blood pressure measurement. I usually obtain a blood pressure and then an ECG prior to the cardiac ultrasound. I place a rubber exercise mat or camping mat on the ultrasound table. This helps prevent the cardiac table from sliding and cushions the elbow of the transducer arm. The cardiac table is placed on the ultrasound table and then the patient is placed in right lateral recumbency with the shaved area of the thorax over the whole of the cardiac table. If the patient is too large to fit on your cardiac table, you can use an exam table and a gurney placed end to end, leaving a gap between the two tables. The patient is placed in right lateral recumbency with the heart over the gap. Some patients cannot or should not be forced into lateral recumbency. Dogs that are too large or resist restraint in a recumbent position may need to be ultrasounded while standing or sternal. It may be necessary to reverse your position and use the left hand to guide the transducer. The positions of the transducer on the patient's body do not change. A dog or cat in respiratory distress should not be forced into lateral recumbency. These patients may need to be studied in a standing or sternal recumbency position.